All right, well, hi there. Welcome to an ElderWatch webinar. My name is Jessica Zawadski. I am the program specialist for ElderWatch Colorado, a 20-plus year collaboration between AARP and the Colorado Attorney General's office. So today for our Getting to Know Medicare with the Centers for Medicare and Medicaid Services, I am pleased to be joined by Monica Ochoa and Dennis Del Pizzo. Monica is a health insurance specialist with the Centers for Medicare and Medicaid Services External Affairs team. Her primary role involves coordinating CMS Denver regional outreach and education initiatives for the 6-state region of Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming. She supports our community in both English and Spanish, helping to ensure that information about Medicare and other CMS programs is accessible and clear. Dennis Del Pizzo is a health insurance specialist with the Centers for Medicare and Medicaid Services in Denver as well. With over 38 years of dedicated service in the Medicare program, Dennis brings a wealth of expertise and institutional knowledge to his work supporting beneficiaries and stakeholders across CMS Region 8, which is Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming. Thank you, Monica and Dennis, for joining us today, and I will let you take it from here.
Wonderful. Well, thank you, everybody. Good afternoon. Thank you so much for that warm introduction and especially for hosting this webinar. We're genuinely excited to have you with us today, and we deeply appreciate you taking time out of your busy schedules to join. My name is Monica Ochoa, and I'm part of the Denver Region Centers for Medicare and Medicaid Services. I'm also excited to have Dennis Del Pizzo, also from CMS Denver Region, joining as a co-presenter for this session. Before we dive into today's agenda, I'd like to pause and recognize each of you for making this important topic a priority. Your commitment to learning and engaging is what makes sessions like these so meaningful. We're looking forward to a lively and insightful discussion, and we hope you find today's webinar both valuable and inspiring. Today's training explains the Medicare program basics, including Medicare Part A, hospital insurance, Medicare Part B, medical insurance. We'll talk about Medigap, Medicare Advantage, Medicare drug coverage, Part D, and related resources. We'll also touch base on some of the topics on how people with Medicare and Medicaid can help fight fraud. If a question arises during the presentation, please take note and ask your questions during the Q&A session at the end of the presentation. We will also provide references to resources and the Medicare.gov website where you can find additional resources and information. To start off, this training module was developed and approved by the Centers for Medicare and Medicaid Services, and the information we are covering today is current as of August 2026. Medicare is health insurance for people 65 or older. Certain people who are under 65 with disabilities who have been getting Social Security Disability Insurance, SSDI, benefits for 24 months. Individuals with ALS or Lou Gehrig's disease who get SSDI benefits, they don't have a 24-month waiting period. People of any age with end-stage renal disease or ESRD, permanent kidney failure requiring dialysis or a kidney transplant, are also entitled to Medicare without a waiting period. CMS mails out the Medicare New Handbook, that product on the right side of this slide. They send this to individuals who are new to Medicare at the time they enroll and to every Medicare household each year in the fall. The handbook explains Medicare and provides information on Medicare health and drug plans. You can also review or download it at medicare.gov/publications. So Social Security enrolls most people into Medicare. Okay, the agency, the Railroad Retirement Board, enrolls both railroad retirees and active employees into Medicare. Social Security and the Railroad Retirement Board also determine the amounts of Medicare Part A, hospital insurance, and Medicare Part B, medical insurance premiums, any late enrollment penalties if applicable, and any income-related monthly adjustment amounts, or IRMA for short. The Office of Personnel Management, OPM, handles premiums for federal retirees. And the Centers for Medicare and Medicaid Services, CMS, sets Medicare policies and determines an individual's entitlement to benefits in consultation with Social Security. CMS also administers Medicare coverage, benefits, and payments. If you aren't getting Social Security or Railroad Retirement Board benefits at least 4 months before you turn age 65, for instance, in case you're still working, you'll need to sign up for Part A and Part B. To avoid a delay in coverage, you should contact Social Security to apply for Medicare 3 months before you turn 65. You don't have to be retired to get Medicare. You can sign up online for Medicare only at ssa.gov. Or you can call Social Security at 1-800-772-1213. You can make an appointment to your local Social Security office, and you can find the local office by visiting ssa.gov/locator. So you can sign up for the Social Security retirement benefits as early as 62 if you wish. However, as I mentioned, you don't have to have Social Security retirement in order to file for Medicare. You can file for Medicare only. If you don't already have Medicare, generally the first opportunity to sign up for Medicare Part A and or Part B is during your initial enrollment period, or IEP. The 7-month period that begins 3 months before the month you turn 65 and ends 3 months after the month you turn 65. After your IEP is over, you may have a chance to sign up for Medicare during a Special Enrollment Period, or SEP. So, for example, if you didn't sign up for Part B when you were first eligible because you have group health plan coverage based on a current employment, whether it's your employment, a spouse's, or a family member's, if you have a disability. So if you have to pay for Part A but don't sign up for it, and or you don't sign up for Part B during the initial enrollment period, and you don't qualify for a special enrollment period, then you can sign up under that third opportunity, which is the general enrollment period, the GEP. This happens from January 1st to March 31st each year. So if you already have Medicare, you want to change how you get the coverage. So to join, switch, or drop a health or drug plan coverage, that's the information on the right side here. You can enroll during open enrollment period, or OEP. So there's also a Medicare Advantage open enrollment period for individuals enrolled in Medicare Advantage plans, open enrollment period for institutionalized individuals, or in certain circumstances under special enrollment period as well. So signing up for Medicare or changing how you get your Medicare benefits are important decisions. These actions must be done timely to avoid any late enrollment penalties and to be sure you get the coverage you need when you need it. These enrollment periods are explained on the next few slides. So let's talk about in more detail the initial enrollment period, IEP. So if you're close to 65, but not getting Social Security or Railroad Retirement Board benefits at least 4 months before you turn 65, then you need to take action. You'll need to sign up for Part A and Part B. You can first sign up during this IEP, which is a 7-month period that begins 3 months before the month you turn 65 and ends 3 months after the month you turn 65. So if you sign up during this initial enrollment period in the first 3 months, then the coverage will begin the first day of your birthday month in most instances. If you sign up and are paying for Part A and or Part B, the month you turn 65 or during the last 3 months of your IEP, your coverage begins the first day of the month after you sign up. If you don't sign up for Part B during this IEP period, then you may have to pay a late enrollment penalty if you sign up later. For Part B, you'll pay a lifetime penalty, which we'll discuss later. If you're under 65 and receiving disability benefits from Social Security, you will automatically be enrolled in Part A and Part B after having those disability benefits for 24 months or later. If you or your spouse are still working, you have a group health plan or GHP, which is a health plan offered by an employer or employee organization that provides health coverage to employees and their families. And you didn't sign up for Part B, then during that IEP period, you may be able to sign up during what's called the Special Enrollment Period, or this SEP. So if you're 65 or older, your group health plan coverage must be based on yours or your spouse's current employment. You'll sign up for Part A and or Part B anytime that you're still covered by this GHP, the group health plan, or during the 8-month period that begins the month after that employment ends or the coverage ends, whichever happens first. So in order to do this, then you'll be completing 2 forms. One is an application for enrollment in Medicare Part B, medical insurance. It's a form CMS 40B. And then also a request for employment information where your HR department completes the information on that group health plan coverage, and that's form CMS L564. So it's important to note that both of these completed forms are submitted to your local Social Security office for this special enrollment period to take place. And with this happening, then usually there are no late enrollment penalties that would apply. So make sure to keep this in mind if, in fact, you will be working past age 65 and later on enrolling into Medicare. If you didn't sign up for Part B during that IEP period, or what we just talked about, that SEP period, the special enrollment period, then the third opportunity to sign up would be during a 3-month general enrollment period, which is January 1st through March 31st of every year. Your coverage is going to start the first day of the month after you sign up. For most people who don't sign up during these portions or eligibility periods for Part A, or Part B or Part D, then this is like their only chance basically to sign up, is this general enrollment period. So I do have to state, in addition, if more than 12 months have passed since you qualified for Part B, you haven't enrolled into it, you've gone through these 3 different enrollment periods, but 12 months have passed, then you'll likely have to pay a late enrollment penalty. That's going to be added to your monthly Part B premium. And in most cases, you'll have to pay this penalty for as long as you have Part B. So keep that in mind as well. If you already have Medicare, the open enrollment period allows you a full 7-week period to review your choices and pick the Medicare health and or direct plan that works best for you. This open enrollment period starts October 15th and ends December 7th of every year. It gives you the opportunity to compare and make decisions and helps ensure that you have essential plan materials and membership cards on hand starting with January 1st when your new coverage starts. So I want to stress the importance of reviewing plans during the OEP each year to ensure that they meet health and drug plan choices for the following year. We'll present another webinar with AARP September 29th with more information on OEP. I will now hand off the presentation to Dennis for the next topics.
Okay, yes, thank you, Monica. And I want to continue on with a discussion on the different parts of Medicare, Medicare coverage options and choices, and what are they, how they work, some of the considerations. And then I want to touch on some of the costs associated with Medicare. But again, as Jessica mentioned, we did provide her with a listing of resources that will hopefully kind of fulfill the information that we're presenting to you, and then allow you to go back maybe and reference certain things that you might want to get more information on. So in the discussion of the different parts of Medicare, and that's what this slide illustrates. So we want to talk about Medicare Part A, Medicare Part B, Medicare Part C is not listed here, but there is a fourth part of Medicare, Medicare Advantage, which we'll talk about in the next slide, and then Medicare prescription drug coverage or Medicare Part D. So Medicare Part A hospital insurance provides coverage for inpatient hospital care if we're admitted. It has a skilled nursing facility benefit for a limited period of time post-hospital hospitalization, should you require it. If you need daily skilled and rehabilitative services, possibly because you're too weak to be discharged, etc., that's where Medicare's skilled nursing facility kicks in and provides coverage for a limited period of time post-hospitalization. Medicare Part A also has a home health benefit, and then it has a hospice benefit for the terminally ill. Medicare Part B medical insurance, so it's covering professional services. So, for example, if we are admitted to the hospital but require surgery, which a lot of times we do, Medicare Part B would be paying the surgeon, the anesthesiologist. When we go see our doctor or our nurse practitioner or physician assistant in an office setting, that's Medicare Part B. A Medicare Part B also provides outpatient hospital, diagnostic tests, durable medical equipment, ambulance services, preventive services. And so together, once people are fully retired and no longer working, and of course eligible for Medicare, most everyone eligible for Medicare are enrolled in Medicare Part A and B, which is going to behave very similar to our employer group coverage that we maintained or that was provided through to us through a spouse who was actively working, etc. The third part of Medicare, Medicare Part D, provides outpatient prescription drug coverage. So it's an optional benefit that is provided for people that don't have access to other forms of creditable drug coverage, such as, for example, a form of creditable prescription drug coverage would be access to retirement health benefits through a former employer. If you're retired military, TRICARE for Life would provide creditable coverage, which would be as good as or better than Medicare Part D. Or another example would be for veterans, prescription drug coverage provided through the VA. So those would be forms of prescription drug coverage that would be considered creditable. But if you don't have those access to those other forms of coverage, then we encourage everybody that's eligible and that is enrolled in either Medicare Part A and or B or both to strongly consider Medicare prescription drug coverage, regardless if you take prescription drugs at the time you enroll in Medicare or not, because like Monica mentioned with Medicare Part B, if you don't enroll in Part D timely, there can be late enrollment penalties. Medicare Part D's penalty is a little bit different if you go 63 days or more without prescription drug coverage. And do not maintain any other forms of creditable prescription drug coverage, then that's where a 1% penalty per month can be added to your monthly plan premium if you have one, for like Medicare Part B for the remainder of your life. And so we don't want anybody paying late enrollment penalties, and it's providing insurance coverage. And so even though you don't take any drug coverage, if you don't take any or you don't take any drugs at all, then you'd want to enroll in the lowest cost plan that's available. And there is a zero cost premium plan operating in Colorado in calendar year 2026. Can pretend to know what the cost will be in 2027. But that's why we encourage it's insurance and don't know what tomorrow brings. And we want to protect us in retirement for any significant financial exposure, such as not taking any drugs and then going to being diagnosed with a condition that requires a very expensive prescription drug or drugs to take care of. And that's why we encourage everybody without prescription drug coverage or creditable prescription drug coverage to consider enrolling in Medicare Part D. So the next slide we will talk about Medicare coverage options. And so this slide illustrates, so we can pretend now that we've made it through the enrollment steps that were required depending on our situation. And now we are enrolled in Medicare Part A and B. And we are automatically placed on the left-hand slide. So when we enroll in Medicare for Medicare through Social Security, we are placed on the left-hand side of the screen, which is what we call original Medicare. And as you can see, original Medicare includes Medicare Part A hospital insurance and Medicare Part B medical insurance. And as I said, that coverage is going to behave very similar uh, to the coverage we maintained while working. We always encourage people with original Medicare, as I was stating in the previous slide, if you don't have access to creditable prescription drug coverage, to consider enrolling in a Medicare Part D plan, which provides an outpatient prescription drug benefit for the drugs and medications you need. And then, of course, if you don't take any drugs, there are low-cost options because it wouldn't make sense for you to be enrolled in an expensive Part D plan if you don't take any drugs or just take one or two drugs that have minimal costs, etc. And then also, we're going to add a new term here. We also encourage people with original Medicare to consider enrolling in a Medicare supplemental plan, or we call this coverage Medigap. It's designed to work only with original Medicare coverage. So if you elect a Medicare Advantage plan, you cannot be enrolled in a Medicare supplemental or Medigap plan. And if you are enrolled in a Medicare Advantage plan, an agent or broker or company cannot sell you a Medicare supplemental plan. It's considered illegal to do that because that coverage does not work together. So again, a Medicare supplemental coverage also offered, like Medicare Part D, offered by private companies to fill in the gaps in original Medicare coverage only. So the Medigap plans are designed to cover the deductibles or cost sharing or copay amounts associated with original Medicare coverage. And you can see what some of those costs might be in the 2026 Medicare cost publication that Jessica sent out or will send out, just as a reference to what are some of the out-of-pocket costs associated with Medicare coverage. And this is a good time to mention that there's no such thing in Medicare as family coverage or self plus one coverage. Medicare is individual coverage. So each and every one of us need to make application for Medicare when we are eligible through Social Security. And then each and every one of us have to pay a Medicare Part B premium. Most of us will not pay a Medicare Part A premium. And I'll explain that in the next slide. So, and I'll talk in more detail about what supplemental coverage is. So, as I was noting, Monica, if you want to go back a slide, wanted to touch on Medicare Advantage. So the other choice, which is an option you can make, but you would have to tell us, I Medicare want to enroll in XYZ Medicare Advantage plan after you make an educated and informed decision, which would include, we hope, talking to your healthcare providers, reviewing your costs, and looking at your previous and past healthcare exposure. If you travel quite a bit and that's important to you in retirement, etc., you'll want to understand the Medicare Advantage plan that might be right for you if that's an election. Now, how you would shop and compare or see what Medicare Advantage plans are available to you is there's a tool on the Medicare.gov website. So Medicare.gov is the official website for Medicare. And there's a tool very prominently in the middle of the homepage of the Medicare.gov website that says Find Health and Drug Plans. If you click on that, you can do one of two searches. You can perform a personalized search by entering your information and creating an account, Or you can do just a general search, entering your zip code, answering a few questions, and then if you want, you can enter the drugs you take, the pharmacies you fill your prescriptions at, and if you're looking for health coverage, for example, a Medicare Advantage plan, you can enter the doctors and or specialists to make sure that those providers will be in network in any Medicare Advantage plans you're looking at. And then once you enter the information specific to you, that tool then is going to produce results based on, I want to see Medicare Advantage plans available to me where I reside, or I want to see Medicare prescription drug plans only. Or the tool allows you to shop for Medicare supplemental coverage as well too. And if you want to enroll in any of the options that you identify as after making an educated and informed decision, you can use the tool for Medicare Part D and Medicare Part C, Medicare Advantage, to enroll in that plan, plan of your choice after you have done your homework and made an educated and informed decision that this coverage is right for me and my situation. You can also get help through 1-800-Medicare, which is our official call center, available 24 hours a day, 7 days a week. Or you can call the Colorado SHIP program, and we'll have their number at the end of the presentation. Or Jessica sent out information related to the Colorado SHIP program, but it's a program that is available in every state in Colorado. It's operated by the Colorado Division of Insurance, and they provide neutral, unbiased counseling and assistance for Medicare consumers in helping you navigate the Medicare program, in helping you with some of the considerations and shopping and comparing for Medicare Advantage or prescription drug plans or Medicare supplemental plans, depending on your situation and what's right for you. And so, Monica, this is where we can go into the next slide. So Medicare Part A, most of us are not going to pay a premium for Medicare Part A. And the reason for that is Medicare Part A is funded by payroll taxes. So if we worked 40 quarters or 10 years, then Medicare Part A is going to be returned to us premium free. And 99% of us qualify for premium-free Part A. And if we don't have the work history under our own record, we will usually qualify through a spouse, or even we could qualify through a divorced spouse record, etc. And that's why the percentages are so high. Now, the people, the 1 to 2% that have to pay a premium, the standard premium for Medicare Part A in calendar year 2026 is $565 per month for people that do not have that have less than 30 quarters of coverage. And then for people that have 30 quarters, but not the required 40 quarters for premium-free Part A, that premium is reduced to $311 per month. And again, for the folks that are impacted, which is a very, very small percentage of the Medicare population that are impacted and have to pay Medicare premiums, then there could also be late enrollment penalties associated with Medicare Part A as well too. But for premium free, we can enroll whenever we want once we're eligible for Medicare, and there would never be a premium if we qualify and have the 40 quarters of coverage, etc. So going on to the next slide. So the decision, do I need to sign up for Medicare Part A? Well, it's free for most people. So we encourage, or we used to always encourage everybody that is eligible for Medicare, whether you're working or not. Or, for example, you might be retired, but covered by a spouse who's actively covering you under their employer plan. We used to always say no harm, no foul. If it's premium free, enroll. And it could act as a supplemental player to your employer plan if you're still working. If you have to pay a premium, you're still eligible. You would just have to be responsible for the Medicare premiums associated with Part A coverage, but that's very, very rare. And then we always encourage people that are continuing to work past 65 to talk to your HR or benefit specialists about how Medicare coverage works with uh, employer group coverage if you're still working past 65, because this is where we stop saying that no harm, no foul rule. And we kind of stopped saying that all the way back, going back to 2001, when health savings accounts with high deductible health plans became more and more prevalent as an option offered through employer plans. And we mentioned high deductible health plans with HSAs. So if you happen to be working and covered by one of these plans, it's very important to talk to your HR or benefit specialist, because you would not want to enroll in Medicare because the IRS says that you can no longer contribute to your health savings account if you are enrolled in Medicare. And then remember, if you're receiving a cash benefit, as Monica said, uh, uh, so if you've filed for Social Security benefits, you're going to be automatically enrolled in Medicare once Social Security sees that you're eligible for Medicare and are receiving a cash benefit. So you'd want to be cautious of enrolling in Medicare if you're continuing to work with the high deductible health plan with the HSA. And most people want to fund that for as long as they can. And one quirk that I always like to mention are associated with Medicare Part A, premium-free Medicare Part A, is if you're working past 65 and you go to enroll, for example, at age 66, Medicare Part A will be premium-free Medicare Part A will be retro back 6 months. And so that's why you got to be cognizant. And so we provided Jessica with some resources related to this provision and what's happening in one of the Social Security pubs we sent out, or it's available in the Medicare U handbook, or talking to your HR or benefit specialist, because with that retro Part A going back 6 months from the month you enrolled in Social Security, if you're working past 65, you got to be cognizant of that and stop funding your HSA 6 months before you go to retire from your employer. Again, for those working past 65. A lot of information there, and answer. Well, I'm glad to answer any questions that might have generated. But we want to make you aware of that, and we're providing you some resources afterwards to make sure that you understand it. So we can continue on with the next slide. So this is a listing of all of the preventive services. And again, don't strain your eyes, don't try to squint. We also provided Jessica with a publication providing all of the Medicare preventive services, but we list these because we want you having a conversation with your primary care doctor once enrolled in Medicare and making sure you're getting all of your preventive services, whether on an annual basis or depending on the type of preventive service it is, as regularly as they're allowed and covered under the Medicare program, because all of these or most of these services are covered at 100%, and it's to your benefit as far as costs, and it's to the program's benefit that you get your preventative services on a regular basis and to detect and to prevent health situations from occurring. So we always like to promote them, but again, don't strain your eyes. We'll send you a listing of all of these services, the frequency, and any age requirements that might be associated with these services as well too. And then moving on to the next slide. So what's not covered in Medicare Part A and B? And we always like to be transparent. And if you were to go look at, if you're still working, if you were to go look at your employer plan that you maintain, a lot of these same services would not be covered. So original Medicare does not cover routine screening eye exams. Now, of course, if there is an eye-related condition, cataracts, glaucoma, macular degeneration, absolutely would be covered. We're talking about routine screening eye exams. Original Medicare does not cover long-term care. It doesn't cover routine physical exams. It doesn't cover hearing aids and the exams for fitting them. Most dental care is not covered. by the Medicare program. And so we just want people to be cognizant of that. And then underneath this red shaded box, you can see that there could be types of coverage that cover this. This is where Medicare Advantage could provide coverage for some of these services that are listed. Depending on the plan that you're looking at, you would want to look at any additional because a lot of the plans will provide limited vision, dental, hearing benefits, usually cover routine physical exams, and a lot of the plans provide uh, uh, wellness benefits like uh, your availability to join um, uh, a club or an exercise, a health club for keeping yourself active, um, maybe lifting a few weights, regular swimming exercises, etc. And so a lot of the plans will cover health club memberships as well too. And so just wanted to be cognizant of that. One of the prominent things that are not also listed here that would not be covered by original Medicare or Medicare Advantage is also we want you to be aware of is care outside of the United States. So Medicare does not provide coverage outside of the United States. And so be aware of that. And we sent Jessica a publication on that too, because that's important. A lot of people like to travel in retirement, and just be aware that if you are traveling, maybe a Medicare supplemental or Medigap plan, if you're enrolled in original Medicare, might provide some international coverage, or you need to look at maybe travel coverage to make sure that you have health insurance. Gosh forbid if anything happened while traveling overseas, etc. So moving on to the next slide. So Medicare Part B, and this is where remember I said everybody has to enroll in Medicare and everybody has to pay a premium for Medicare Part B. The current Medicare Part B premium in calendar year 2026, subject to change in 2027, is $202.90 per month. And then we want to spend a little bit of time on this right side, this box right below that 202.90 on your premium could be higher depending on income. So let's talk about that. So we can go to the next slide. So back in 2007, Congress said we want higher income Medicare beneficiaries to pay a greater share of the Medicare premium. And in 2011, they did the same thing to Medicare Part D. And so just be cognizant and aware of this. So most beneficiaries, approximately 88 to 90% of the beneficiaries here in Colorado are not going to be impacted by this and pay that base beneficiary premium, which is $202.90. And that amount is highly subsidized. It's set at 25% of program costs. And so what Congress did back in 2007 is they set different thresholds for people that have higher income. And you can see going down this chart that through different income thresholds. So above $109,000 of income for an individual, or above 218 as a couple, is where you could be impacted by IRMA. And so these adjustments would change from starting at 35%, 50, 65, 80, or 85%, depending on your income amount. Social Security also administers this. This is called, again, income-related monthly adjustment amounts, or IRMA. And they look at this on an annual basis. And so it's not a lifetime assessment. It's regularly reviewed. And they, for example, if we are enrolling in calendar year 2026 in Medicare, Social Security would be looking at our most current tax return, which could be 2 years old, or our 2024 tax return. And so if you get a notice after enrolling in Medicare from Social Security, read it completely. And if your situation has changed, say, for example, because you're retired, By all means, follow the instructions in that notice from Social Security and ask Social Security to redetermine or appeal their determination. And for example, you could provide them with your 2025 tax return, for example, would be an example of proof that you could provide that, hey, my situation has changed significantly based on the income information that you're looking at. I'll also note that Social Security is looking at modified adjusted gross income. So it's a figure not on our tax return, but they're using two columns on our tax return to arrive at modified adjusted gross income. They're looking at our adjusted gross income, and they're looking at any tax exempt interest. They're adding those two columns together, and that's where they're looking at, are you above $109,000 if you're an individual? Or are you above 218 if you're a couple, etc.? So wanting to make you aware of that. And I'm not a financial advisor, nor is Monica, nor is Social Security. We can't be giving out financial advice because we're not trained to do so. And we don't have your entire situation in its totality, only a trained financial advisor that's trained to look at this and do this in looking and having a complete picture of your total financial situation. But if you're making withdrawals from any taxable accounts, so traditional retirement accounts, or doing any Roth conversions, well, when you do that, that's income. And if you do a significant withdrawal from a traditional account, is that going to bump you or throw you into one of these higher thresholds? And or is there things that you could do to minimize or avoid being impacted by IRMA? And that's where working with a trusted fiduciary that's trained in looking at this and helping you navigate might be a good call if you might be close or you could be making some significant withdrawals from your taxable accounts that could bump you into one of these thresholds. So going on to the next slide. So the decision in Part B, and this is kind of a reinforcement slide, and this is where I will mention, again, Medicare Part B has a monthly premium. Everybody has to pay it. And how Medicare Part B premiums are assessed is if you're receiving a Social Security cash benefit, it's going to be automatically your Medicare premium is going to be automatically deducted from your Social Security cash benefit. If you're not yet drawing Social Security cash benefit or retirement benefits, then you're going to be billed every 3 months, or you can set up what we call Medicare Easy Pay, or use a Medicare.gov account that you would establish to pay on a monthly basis. So again, either automatically deducted if you're receiving cash benefits, it's going to be billed to you, or you can tell us, I want to pay it monthly through automatic deductions from my checking account, which you would tell us and give us authorization to do, or you could pay it directly through your Medicare .gov accounts, individual Medicare.gov accounts that you could establish on the Medicare.gov website. And then, as Monica said, when she mentioned these Medicare Part B Special Enrollment Period, if you're working in a group health plan, if you're working and still covered by group health plan coverage, you probably would want to delay enrolling in Medicare, etc. But this is just a reinforcement slide. And then the last bullet, sometimes we must have Medicare Part A and B in order for us to have access to other coverages. And so, Monica, can we go to the next slide? So here are the types of coverage that requires you to be enrolled in Medicare Part A and B. If you want to join a Medicare supplemental plan, so a Medicare or a Medigap policy, it requires that you are enrolled in Medicare Part A and B. If you want to join a Medicare Advantage plan, you have to be enrolled in Medicare Part A and B to be eligible to join and continue to pay the Medicare Part B premium. If you're retired military, TRICARE is going to notify you leading up to your 65th birthday that you need to enroll in Medicare Part A and B in order for TRICARE to continue. And TRICARE then becomes TRICARE for Life, or wraparound coverage, which pays secondary after Medicare covers. CHAMP VA works the same way. And then small employers. So if you are working for a small employer, and what we classify is a fewer than 20 or more employees, or excuse me, fewer than 20 employees, period, then Medicare coordination and benefit rules state that coverage, Medicare coverage, once you become eligible, would be the primary payer to that small employer, fewer than 20 employees. And so just be cognizant of that. And usually small employers would be notifying you of that requirement. But if you're working for an employer with an employer of more than 20 or more employees, then of course, if you're working past 65, that coverage is always primary. Medicare would be the secondary, and that's where, as Monica mentioned, you could delay enrolling in Medicare Part B until you fully retire, or if you're retired but your spouse is still working, they're covering you, and you could delay enrolling in Medicare Part B until they fully retire and are no longer working, etc. So just be cognizant of situations where you have to have Medicare Part A and B to be eligible for other types of coverage. And then, Monica, we can go to the next slide. So Medicare Part D, in a little bit more detail, it's optional. And we have to elect a plan based on our situation. I don't take any drugs at all. I'm going to enroll in the cheapest plan available. Or I take a lot of drugs and I want to narrow down my search, so I'm going to use the Medicare Plan Finder tool. I'm going to reach out to 1-800-Medicare or the Colorado SHIP program to help me narrow my search so I can identify the best Part D plan that's covering the drugs that I take at the dosages that I require at the pharmacies that I prefer filling them at. And Medicare Part D plans work on the basis of formularies. So they all have a listing of covered drugs, and they're required to cover drugs in a range of drug categories that are predominantly prescribed to the Medicare population. And then those formularies can change throughout the year based on FDA could consider a drug dangerous, or there could be significant side effects and pull it from the market, or there could be generic equivalents added and maybe a brand name drug is taken off a formulary when that generic equivalent becomes available. But it can change on a regular basis, and you have to be cognizant of that. But the plans also have to notify you of those changes. And then there's going to be out-of-pocket costs. So you could pay a premium for Medicare Part D. There is a zero premium plan available in Colorado. And then when you go fill a prescription, there is going to be some out-of-pocket costs associated with that. And there is a program, we call it Extra Help, or the low-income subsidy, that's available through Social Security. So they administer that you can apply for. If you have limited income or resources, that can help you with your Medicare Part D premiums and your out-of-pocket costs to make sure that you are not limiting or missing or not taking all of the medication that you're required, and you're ending up presenting yourself in an emergency room, which we don't want, etc. So there are financial assistance programs available for prescription drug for people with limited income and resources. And then moving on, Medicare Part D, as I mentioned, in 2011, Congress did the same thing, the same chart, the same thresholds. Over on the far right-hand column, the only thing different is the adjustments. So above $109,000 or above a 218 as a couple, you can see that adjustment plus any plan premium that you would be expected to pay depending on the plan that you were enrolled in. So these are Medicare Part D, IRMA. Going to the next slide is where we get into the late enrollment penalty, which I mentioned early on. So just like Medicare Part B, if we don't enroll in Medicare Part D when we are first eligible and we let 63 days or more go by and we do not have other creditable coverage, then that's where the late enrollment penalty, which is 1% based on the base beneficiary premium in 2026, which is $38.99. And that amount changes anytime you see a dollar amount subject to change on an annual basis. Going on to the next slide. So the decisions, so if you have creditable coverage, but you are covering family members, probably want to make sure that any election of Part D wouldn't throw your spouse off of your coverage that you maintain. So you'd want to check with your former employer, et cetera, before you do anything. Or if you have creditable coverage, but that creditable coverage doesn't provide coverage for a specific medication, and Medicare Part D covers it, and it's much more affordable, you got to look at those situations. And so it's an individual decision based on your circumstances and situations. And then if you don't have creditable coverage, again, we want people enrolling in Medicare Part D because we don't want anybody paying a late enrollment penalty. And then remember that there is financial assistance for people with limited income and resources. Going on to the next slide, which we talk about Medigap. So Medigap is only designed to work with original Medicare. These plans are sold by private companies, and they fill in the gaps in original Medicare coverage. So Medicare Advantage doesn't work with that type of coverage, but they fill in the gaps in original Medicare coverage, such as your co-pays, co-insurance, and deductibles. And the plans are standardized for comparison shopping. So there could be multiple companies selling different types of policies, but when they're selling the same policy, coverage will be exactly the same. The only thing that will be different is how much that company charges, and then how well that company is as far as administering that Medicare supplemental plan, et cetera, how well they provide customer service, how well they pay claims, et cetera. So that's the differentiation that you need to look at, and maybe having a conversation with your healthcare provider. And then going on to the next slide. And again, you don't need to squint your eyes because we sent out some resources. But this is a chart of the 10 standardized Medigap policies that are available, going all the way from a policy A, which might be a Chevrolet, to a policy G, which might be considered a Cadillac policy. Again, depending on what you can afford, how you want to protect yourself financially, so that you're not exposed to high health care costs in retirement, et cetera. And again, looking at your situation, looking at the premiums, looking how much you can afford, and making sure that when you put your head down on the pillow at night, that you have peace of mind that you are adequately and financially protected. Gosh forbid if you had a catastrophic healthcare event arise, et cetera. And then Medigap policies are the only type of policy, going on to the next slide, Monica. Medigap policies are the only policies that can be medically underwritten. And what I mean by that is that Medigap carriers could refuse to sell to you if your health is bad. And because of that, there are certain times the Medigap open enrollment period occurs when two things occur: age 65 and over and enrolled in Medicare Part B. A 6-month Medigap open enrollment period starts. And that is the best time to shop and compare. And then there can be also some opportunities if you elect Medicare Advantage within 1 year after electing that coverage to switch back to original Medicare with the Medicare sup on a guaranteed issue basis. And then Monica, for the sake of time, for Medicare Advantage, it's an election. Medicare Advantage plans, remember, we have to be enrolled in Medicare Part A and B. All of the plans are required to cover everything under Medicare Part A and B. They usually provide prescription drug coverage, and they also provide extra benefits like limited vision, dental, health club memberships, etc., that are not covered by law by original Medicare. And so, Monica, I will then turn it back to you for the remainder, so you can skip through these slides. I pretty much touched on that, and then you can touch on fraud and abuse and the remainder before we wrap up.
I just want to go through very quickly and give you some of the resources. So for fraud and abuse information, the best source is Medicare.gov. You're the very first line of defense against fraud, and we have some tips. You can report it, of course, through 1-800-Medicare, or you can also contact the Senior Medicare Patrol, which is SMP. In Colorado, they are at 1-888-696-7213. So Senior Medicare Patrols empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. You also heard Dennis mention the Medicare account on Medicare.gov. This is a very good resource to have. If you do set that up, you can print an official copy of your Medicare card. You can review all of your personal Medicare information, learn about Medicare premiums, pay them online, get the bills from Medicare through an enrollment, automatic enrollment as well. Make sure to consider protecting your information, your Medicare information number. Guard it like if it's your Social Security card and your credit card. Only share Medicare information with the trusted healthcare providers and plans, and always check your Medicare claim statements to make sure that they are accurate. Let us know at any point if you see anything that seems suspicious or you did not get, or if you receive any kind of calls asking for your information, make sure to hang up, and then you can go ahead and report that to us at 1-800-Medicare. The 4 R's for fighting Medicare fraud. Very quickly, record the dates of your doctor's appointments and the medical exams on a calendar so that you have those handy when you are looking through some of the services. And then also make sure to review those services that were provided, report any suspected fraud, even if you're not sure. And remember to protect all of your personal information. So we have a list of resources as well here. And then I want to point out on our Medicare resources, there's also the Social Security information, but the State Health Insurance Assistance Program, or SHIP. These are counselors that are unbiased, and they help Medicare beneficiaries, their families, and caregivers. This is a community-based network of counselors that provide Medicare assistance in person and by phone. You can find a local SHIP counselor in your area based on the zip code that you live in, but also you can contact the Colorado SHIP at 1-888-696-7213. And there's for different counties, you have the specific counselors. And I'm going to pause there and hand it over to Jessica to see if we have any questions that are pending.
Thank you, Monica. One question that I get a lot when I'm doing presentations on fraud and scams is actually related to SHIP. So I think this is a good time to ask. What is the difference between SHIP and a Medicare broker and the counseling they offer? And can you use both? Should you use both?
Yeah, and so happy to. So the difference, Jessica, is as we stated, SHIPs are volunteers. A lot of them are volunteer professionals that have offered to utilize their time and resources to help. We not only educate and train them, but they provide neutral and unbiased counseling for Medicare consumers, their families and friends related to Medicare. They're never going to tell you or state to you, XYZ is the best plan for you, Jessica. It's always going to be up to you. They're going to listen to your situation. They're going to throw out the considerations and choices you need to make. Um, but ultimately the decision rests with you. Whereas a Medicare agent and broker, a lot of the agents or brokers usually operate off commissions. They should be performing the same things that the ships are doing, only that they could be influenced by that commission,
Right.
in that it could steer them a little bit in what plans or products that they are recommending to you based on the products they sell or the commissions that are associated with those products. But a good agent and broker, and there's lots, you could be working with both. And a ship counselor would say, you know what? That's a good question to call the plan on to make sure how they specifically cover that cardiovascular test that you require. And this is where an agent and broker could zero in and provide you the specific coverages and the details, that is product specific to the different plan that you're looking at. The bad, where we hear the concerns related to brokers is, there's bad apples in every bunch, and the people that are out selling policies based on, they don't care what's important to you. They're looking at their commission. And again, these are the bad apples, and they're fewer far between, but they're looking out for their pocketbook and not yours. And even though you said, hey, I want to keep my doctor, hey, I want to make sure that I'm able to travel and visit the grandkids, and you are enrolled in a plan that doesn't allow you to go outside of the network or doesn't cover your healthcare provider anymore, well, they just got you into significant trouble. Again, if you happen to experiencing anything like that, report that immediately to 1-800-Medicare, because that's considered marketing misrepresentation. And we look into that very seriously, and the Colorado division looks at those situations very seriously. But there can be benefits to both.
Awesome. Thank you, Dennis. Medicare as a program, as well as, all things government right now, there's a lot of information. A lot of people are talking about them. What is the best way to stay up to date with changes and news and kind of cut through the noise to make sure that the information that you're getting is transparent and accurate?
Through the official Medicare resources, because a lot of people like to repackage, a lot of orgs, a lot of groups like to repackage that, but making sure that you are maybe not reading it from cover to cover, but when you get that new Medicare New Handbook, the new 2027 Medicare New Handbook is going to be out the middle of next month already. Stay on top of that, because that's going to alert you in the first few pages of the book that's significant, any significant changes or any different things that are happening, that you should be aware of in your Medicare coverage. Your Medicare plans, if you're enrolled in, they're going to send you documents at the end of September saying, this is how this plan is changing for 2027. And it's a standardized form that is going to list for you all of the changes, premiums, cost sharing, coverage, provider networks, pharmacy networks, that is important for you to be aware of, because boy, if the plan is significantly changing their costs, there might be a better deal out there, and that's where you want to look at. So look, if you're enrolled in a Medicare Advantage plan or Medicare prescription drug plan, always look for the annual notice of change, which the plans are required to provide to you, either hard copy or electronically, no later than the 1st of October, so that you can start doing your education and making an informed decision as far as, I love this plan, no significant changes, I'm going to stay put. That's great. But if there are, we want everybody shopping and comparing, because there's multiple fish in the sea, and we want you enrolled in the coverage, not that's best for the insurance company or the agent, but that's best for you. And then reaching out when you have questions or you hear some things that are just really troubling you, reaching out to 1-800-Medicare. available 24 hours a day, 7 days a week, or going to the Medicare.gov website to doing some spot checking or verifying what you heard or to confirm if this is a myth or reality, etc. So using trusted Medicare resources, reaching out to a SHIP counselor is what I would recommend, Jessica, in answer or response to your question.
Okay, well, we don't have any questions in the chat, so why don't we end with a little teaser trailer for our next webinar, which will be September 29th. If you saw this, if you learned about this current webinar on Facebook, we will have that posted shortly. And if you learned about it through other communications from ElderWatch, they will be in our following communications for September. So what can our guests expect for next time?
Thank you so much. We're going to have a lot more information on the Medicare open enrollment period. We will also dive into some of the different marketing scams, alerts, some of the different fraud awareness as well. So definitely tune in, check us out, and we'll provide more information on any other questions that come up for Medicare.
Agent and broker do's and don'ts.
Perfect.
The Medicare Plan Finder tool that I talked about, that allows you to find what options are available to me where I reside, and people are already interested in that, and that's the best way to get it. Whether you like to self-help on via Medicare.gov, or calling 1-800-Medicare or a SHIP or an agent and broker, etc. too. But we want to talk about that Plan Finder tool in a little bit more detail too, because it's very powerful in helping you narrow down your searches to determine which coverage is right for me and my situation.
Awesome. Well, we look forward to seeing you all next time. Thank you so much for joining us today. We hope to see you next time. Thank you, Monica and Dennis, for your time. And thank you all for joining this ElderWatch and CMS presentation. Enjoy the rest of your Wednesday. Bye.
Bye.
Thank
Thank
you.
you.